All right, Hartford Hospital's heart transplant team recently reached a milestone. They performed 500 heart transplants. The transplant program continues to be recognized for their clinical outcomes and the number of transplants performed. Here to talk more about this is Dr. Jonathan Hammond, the surgical director of Heart Transplant Program at Hartford Hospital. Doctor, welcome.
Thank you. It's a pleasure to be here.
Pleasure to have you. So the Hartford Hospital Transplant Program recently celebrated an important milestone, 500 heart transplants. Tell us about this significant milestone and how it was achieved.
Well, heart transplantation, like any transplant, is really a team sport. The first team at Hartford Hospital consisted of Drs. Robert Schweitzer, James Doherty, and Henry Lowe, who took care of our first patient actually back in 1984. The 500th transplant is the culmination of over 35 years of cooperative effort, which now involves heart failure cardiologists, cardiac surgeons, transplant coordinators and nurses, intensivists, infectious disease specialists, immunologists, and a whole host of others. So this milestone is really a tribute to all of their efforts.
Very nice. All right. With the past year and the challenges of COVID-19, Hartford Hospital continued to perform heart transplants. How did the team make that happen?
Well, we recognized that time would not stand still for our patients suffering from advanced heart failure. So we hope to be able to continue our transplant efforts throughout the pandemic. As an institution, we put into place strict COVID mitigation protocols with rigorous testing and personal protective equipment for all involved in patient care. All potential donors and recipients were screened prior to transplantation. And we were confident that with meticulous attention to detail, we could continue our transplant activity. Fortunately, that proved to be the case.
Very nice. So the heart transplant program continues to make amazing strides for patients and donors. Can you explain how patients can get off the transplant list and into transplantation?
Sure. Well, patients with advanced heart failure who are not doing well on maximal medical therapy are referred to the Center for Advanced Heart Failure and Transplantation. There, they're evaluated by a multidisciplinary team to see if a transplant would be a good option. If they're approved for a transplant, they're put on the wait list. Organs are allocated based on a computer algorithm which takes into account the patient's blood type, the potential recipient's degree of illness, their height and weight, and the distance the organ would have to travel to get to the recipient.
All right, this 500th transplant is a huge accomplishment. So how will the program continue to meet these milestones, and what's the program's future plans?
So it's got to be kept in mind that while 500 transplants is an important milestone, those 500 patients actually represent only a small fraction of the total number of patients who've suffered from advanced heart failure in Central Connecticut since 1984. So the Center for Advanced Heart Failure and Transplantation will continue to try to bring advanced therapies, including transplantation, but also other technologies, to as many patients as possible. This will involve outreach to make sure that patients are aware of their options. It will also involve making the best use of all organ donors by using techniques used by other solid organ transplants to recover as many hearts as possible for our patients. With these efforts and the team we have in place, we believe the future remains bright for heart transplantation at Hartford Hospital.
It's amazing. I have two family friends with transplants. All right, Dr. Jonathan Hammond, thank you so much.
My pleasure.